Okay. All right. Well, welcome everybody. As people come in, I'll let them in the group. I think there was a little mishap with the link, so hopefully folks see it and they don't miss this workshop because it's going to be a good one. So before I get started, just make sure that you have something to write with because this is a workshop, so it means that we're going to interact. And if you have any questions about occupational therapy documentation, this is the time and this is the workshop to ask your questions. And we are going to jump right into this. So let's get started here. And feel free to interrupt me at any time, any point in time if you have any questions. That is totally, totally fine. Okay. So this is how to write the perfect note, occupational therapy documentation. I've been a occupational therapy practitioner since 2012. I mainly worked in skilled nursing facilities. I did travel therapy, where I worked in about between travel therapy per diem and just permanent position, I covered probably about 25 buildings. And I also worked a short period of time with children pediatrics, specifically a sensory integration clinic. That was one of my focus when I was doing my clinicals. And now I do tutoring. So that's just a quick snippet about me if you don't know me or you're not familiar with me. But yeah, so let's jump right into this, okay? So, important thing to understand when it comes to documentation is continuity of how you're writing. Okay, so it's very important that your documentation is going to be effective. All right, to ensure all team members can continue where you left off. So a lot of times, if you're seeing one patient on Tuesday and Monday and Tuesday, and maybe that patient now goes to one of your coworkers on Wednesday, they can simply just read your note and pick up where you left off. So that's why it's very important that you write good treatment notes for continuation and continuity of care. Okay. And that's also going to help a lot when you are doing your progress notes. And when you are also, when the OTR if you're OT on this call, when you're also looking to do your reevaluations or discharges. So I'm not sure if everyone in this call is a student or if some of you or any of you may actually be a practitioner, but that's just one thing to keep in mind. Okay. So it's important that we understand the SOAP method framework, okay? So of course in school you've learned about, SOAP, subjective, objective, assessment, plan. We're going to mention that, we're going to cover it, but the focus is really how do you actually take that and actually put it into a therapy note when you're actually working in the field. So that is what's going to be most important, okay? Any questions so far? Am I good to keep going? Okay, perfect. All right, so some skill terminology that's going to be very important. So when you're writing your documentation, you always want to start off with who you're addressing. Okay, so it's either going to be the patient, the client. Okay, that is universal, that is general how we will start off our note. Okay. And then you are going to go into some kind of level of instruction. So either you're doing patient is instructed, so patient instructed, patient demonstrated, patient, or you could say client facilitated, displayed, implemented, stated. A lot of times when you see stated or reported, that's going to fall under your subjective. So you always want to have this flow of your writing. So you're always going to start with either the client or the patient. And if you are preparing for your NBCOT exam, you'll notice that the questions will say the patient, the client. Okay. And then as you are writing, you're going to have filler words that you're going to utilize in your writing. And those filler words can look like patient instructed in A, B, and C, and assessed or analyzed, established, compensated, modified, remediate, inhibit, right? Fabricated. Fabricated a lot of time will be if you're doing something that has to do with splinting, right? Adapt, safety. Safety is always going to be a word that you constantly will use in your writing. Okay, so this kind of gives you a flow of the terminology. Now, when you are thinking of, or I should say, when you have to do with anything that's non-skilled versus skilled, there is a way that we write it, right? So if you are looking at terminology and the terminology just says patient said or client told, that is actually considered non-skilled. Okay. So instead of saying patient said or patient told, it's better to say patient or client stated, patient or client reported, patient or client expressed, patient articulated, okay? Patient indicated. Now, if for any reason we're doing a subjective and the patient is nonverbal, okay, you would say observe the patient, okay? So that's how you would make it more skilled terminology when you are writing. Now, another example is, let's say, again, non-skilled is gave patient. We wouldn't say gave patient. The best way of writing that is saying the client was issued or client was provided with. Okay, so if you're giving, let's say, an adaptive equipment, you would document that as saying client provided with a reacher for lower body dressing, for example. Okay. Any questions with that? Pretty straightforward. Okay.
Uh,
Yep.
Excuse me, like,
Sure.
the inhibit, what kind of situation that we use inhibit in our documentation? It's a filler word that I don't use that much.
Okay, sure. So, for example, you can use inhibit if you're working with someone that has very strong, let's say, spasticity. Okay, so let's say, let me use a layman, let me say it in layman's term. If you are working with a patient that has very strong tone, okay, meaning that they're very stiff and you're trying to do range of motion, okay, with them, and you're trying to do passive range of motion. When you use that word inhibit, you are inhibiting against that tone. So that means that you are trying to break up the tone. You're trying to relax the muscle. So when you're documenting, you can say patient participated, or you can say conducted passive range of motion in order to inhibit um, hypertonia in that sense. Okay. So whenever you're thinking of the word inhibit, it's something you're trying to go against. Does that make sense?
Yeah, thank you.
You're welcome. You're welcome. So these are filler words, so it all depends on what you're doing in your session is when you're going to use this. Another filler word could be like observation or observe, right? Again, it all depends on where you are at in the OT process. You might be using filler words in maybe you're assisting with the evaluation, right? Maybe you're if you are an OTA, maybe you're helping out your OTR, but if you're OTR, you're going to use terms like analyze and assess. Okay. All right. Awesome. Let's continue on. So that was skilled terminology. Now we're going to talk about skilled language. Okay. So when it comes down to non-skilled language on your writing, you really don't want to write patient did upper body dressing with modest verbal cues given to complete the task. I know a lot of people might say that sounds okay, but you really want to make sure that you're including that medical context to your writing, which is going to be very, very helpful. Okay, so instead of writing it in this manner, where it's really not giving us a lot of information, it's very basic, it's very general, a skilled way of writing that same information is saying patient instructed in upper body dressing training requiring mod assist with 25% verbal cues for task segmentation, to facilitate motor planning, sequencing, and bilateral coordination to increase independence with ADL performance. So when you're writing like this, it's really giving um, a lot of information and attention to detail in what is happening. Okay. Whereas if I was to come and just look at the non-skilled note, I'm like, okay, well, I can see that I can see that there is mod assist, but how much verbal cues and how are they, what specifically are they focusing on? Okay. Whereas the skilled note, me as, let's say, the therapist coming in after the person, this gives me a lot more meat. And also, this is going to look really good for reimbursement purposes because a lot of times the insurance companies are going to be looking for more context. Okay. Any questions with that? Good, good. Okay, awesome. So then the next one, another example that I have here that's considered non-skilled is let's say you said patient engaged in fine motor activity with pegs with tactile cues. Okay. Do you see how that's very vague? Even though it tells me that you're working on a fine motor activity and you're using pegs, it does not give me much information, especially as me coming in after you. Remember I mentioned about that continuum of care. It doesn't tell me a lot. Okay. But if I was to write it in this manner, saying client participated in seated tabletop pegboard activity with minimal tactile cues to improve fine motor coordination, in hand manipulation, and visual motor planning to promote independence in grooming tasks. Now I know, okay, so we're working tabletop. So that tells you that the person is seated tabletop activity. They're using a pegboard. Okay. They required minimal tactile cues. So that gives us context that they need a little bit of cueing, but they don't need max cueing, right? So that gives us context. It let us know what they're working on. So we're working on fine motor, we're working on in-hand manipulation, and we're also working on visual motor. Okay. And why are we doing it? Well, we're doing it because we're working to improve the grooming task. Do you see how that works there? Okay. Any questions before I move on? And please stop me from talking too fast. I just want to make sure you guys have time to actually do the writing because we're going to do the writing today. All right. So, quick review of SOAP notes. Of course, everybody has seen this in school, but we're going to just kind of run through it as a quick review before we actually get to a case study. So, when it comes to subjective, okay? Subjective is just simply the perception of the patient. What is your patient saying to you? Okay. If this is let's say if you're working in pediatrics, right? The subjective is most likely going to come from the parent. Okay. It could still come from the child, but it's usually going to come from the parent depending on the age of the child. Okay. So we're going to document based on mommy or daddy asking how is the child doing? How's the behavior? How's the whatever strategy we may have given them at home? That is where our subjective note will come in that manner. If we're working more with teenagers or older adults or something like that, our subjective is going to come directly from them. And it's simply the reporting of symptoms, feelings, perception. Okay, it can be a direct quote, which is totally fine and appropriate from them. It could be maybe facial grimace. Maybe the person is nonverbal, so they can't verbalize how they're feeling, so we can document that based off of their facial grimace. We can also include in the subjective the caregiver. Um, Reporting. What has the caregiver said? What has nursing said? Okay. Um, and we want to make sure that it is very clear. We want to make sure that we're not using jargon or anything in that manner. So that's going to be important. So an example of this is, let's say, patient complaint of 6 out of 10 right upper extremity shoulder pain during overhead task. Okay. Of course, you could fill that in more, but that is kind of the basis and the general of a subjective. Okay. So you could see we're still adding data. So if you're working with a patient, they're like, oh my gosh, I'm having pain today. Let's say they're like, oh, I'm having back pain today. You ask them, okay, is it your lower back? Yeah, it's my lower back. Okay, well, tell me from a scale of 0 to 10, 0 being, of course, no pain, but I know you're having pain, and 10 being the worst pain you can imagine, what number would you say you're at? And if they say, well, I feel like I'm a 6, and that's how you would document 6 out of 10. Okay? Any questions? All right.
Uh,
Yep.
so yeah, I have a question.
That's okay. Go ahead.
Like, I'm from Sri Lanka, so when I'm documenting my case reports, if I want to use the quote, like direct quotes, how could I use that? Like, I have to translate this language into the main language that I'm documenting, or do I have to just quote in original language and then translate it into English?
Well, well, you're working in a facility that I'm assuming speaks English, right? So,
Sorry?
So I'm assuming you're working at a facility that speaks English or
No. No, I'm working in Sri Lankan population that speaks Sinhala, but
okay.
I'm like, as I'm a student of final year, so I have to document it in English. So I'm
Okay.
assessing the clients in my mother tongue, and I have to document it in English. So,
Okay. So you would have if you have to document it in English, then you would have to transcribe it into English.
okay, thank you.
Yep, no problem. Because you want to remember to whoever is going to be reading the documentation, it needs to, present in that manner. So if the documentation needs to be in English, then it'll need to be in English. If the insurance company that you're submitting this to needs to see it in English, then it's going to need to be in English. Okay. But of course, if, you know, whoever's reading it and, if whatever the requirement is, if the requirement is that it needs to be in your native tongue, then that's what it would be. You would write it in your native tongue. But if it's required that it needs to be in English, then you have to follow that requirement. Okay. So objective. So quick review of objective. It's only factual information when we're thinking about objective. And again, this is just a quick review. We're not writing every single thing out in this manner, but it kind of gives you this the basis of how your notes should look. Okay, so when it comes to objective, it's always a measurable data. Okay, so when you're observing, you always want to make sure it's measurable. So this is an idea on how your objective, the portion of you writing your objective would look like, right? So you're going to always want to start with either your client or your patient, as I mentioned before. You're never going to put the person's name. Okay. So it would say client instructed. What are you doing? So for example, client instructed in toilet transfer. That is the activity. Where's the location? So maybe they're in the therapy gym. Okay. So maybe in the therapy gym, there's a section to do toilet transfers and tub transfers. So you would write it as patient instructed in toilet transfer within therapy gym. Bathroom. Okay. Requiring what's the level of assistance? Maybe they're a min assist. So requiring min assistance to what is the purpose of the session? What are you working on? Well, the purpose is to facilitate improvement in transfer. Okay. So let me do it one more time so you can see how that's going to go. So patient instructed in toilet transfer within therapy gym, requiring men assist to improve proper hand placement and safety to facilitate independence in toileting. Okay, that could be an example on how your objective would look like. And you can always include more. You can include tactile cues provided for proper hand placement and pivot. You can even take it another step further. What kind of transfer did you do? Was it a stand pivot transfer? Was it a squat pivot transfer? Did you use was there maybe a sliding board or any kind of device utilized in this transfer. So you could get very detailed and you want to just make sure that it's factual observation. So let's say during the transfer, maybe the client had a loss of balance. So that's something you would document. During transfer, patient had loss of balance, requiring mod assistance to self-right. Okay, that is how we can document that. All right. Any questions with this one? No? Okay. All right. And then your assessment is really
Yes,
just
I'm ready.
taking, I'm sorry, question?
I'm sorry, I need to mute.
Okay. So the next one, assessments. Assessment is really combining your subjective and your objective data to guide your treatment decisions. So now you're really looking at the findings and interpreting the data. All right. So there's like three P's you want to think about. You're thinking about what was the problem, what's the progress they've made through that problem, and what is their rehab potential. Okay, so here's an example of that. So client demonstrated improved upper body garment management, evidenced by accurate return demonstration during donning and doffing a pullover shirt, supervised, continued skilled OT service are recommended to facilitate upper body dressing independence. Okay, so do you see the difference between objective and assessment? Because I do feel like people tend to get those two a little confused. So the assessment is really just looking at what you're seeing now. What is your, um, I should say, what is your viewpoint based off of the objective information and also what the client has said? Okay. Any questions with that one before I move on? Okay. Excellent. Excellent. All right. So the last one before we actually look at a case study, the last one is planning. Planning is very straightforward, very easy. Okay. It's really just outlining the clear, specific plan for the therapy session. So really the focus here is, are we continuing with our sessions with our client, or are we going to plan for discharge with our client? And if we're planning for discharge, now we're thinking about DMEs. What durable medical equipment will they need or not need? Okay, we're thinking about home exercise program. Will they need a home exercise program or not? We're thinking about, do we need to schedule caregiver training before that person is discharged? We're thinking about, where are they going? Are they going to be able to return back home, or do they need other services? Okay. And that is really your overall when it comes to your therapy documentation. So now we're going to take all of this information and we're going to put it together, and we're going to actually look at a real world situation. We're going to look at a case study in the client. Okay. So before we do that, we would want to just remember these things. We always want to remember when we're documenting, we want to make sure we're documenting with accuracy. Okay. We want to make sure whatever we're writing is true. Okay. We want to make sure it's clear. So clarity is very important, because if it's unclear, we're putting ourselves at risk, and the facility we work for lack of reimbursement, or reimbursement being denied. Okay. And we want to make sure that as we're writing, it's not vague or incomplete. Okay. So you want to make sure that you're paying attention to that. And we don't want to overuse abbreviations. Abbreviation is very okay to use. Like a lot of times you'll see mod A, or you'll see UBD for upper body dressing, um, S/L for status post, especially if someone had a surgery, right? Those are appropriate abbreviations, but we don't want our whole um, documentation to just be straight abbreviation. And I've worked in facilities where there was definitely some overuse of abbreviation, and I was versed enough to understand what the clinician was writing. But if someone's coming in, they might not know some of those abbreviations, it can make it very challenging. Okay. And of course, you want to make sure that whenever we're documenting, it's measurable goals, right? We're documenting to make sure that we are meeting those goals. So whatever the goals is for the patient, we want to make sure that we're documenting within that alignment and not outside, right? We don't want to document for let's say, gardening, because we're like, oh, we have a great activity. Let's do gardening for a patient, and you're focused on gardening with their fine motor, but this person's issue is they had a fall and their balance is really bad, right? And you have them sitting down working on a gardening activity. So you want to make sure that it's based off of the goal. Now, a way to um, improve that, because you can always take an activity and align it with the goals, is now maybe they're doing that gardening activity, but we're keeping it very basic, and maybe they're standing with a rolling walk in front of them, and you're really focusing on how well um, they're maintaining their balance as well as how long they have with activity tolerance. So that's how you can do it. And then, of course, you want to make sure it's concise. You don't want to write for days, because at the end of the day, when you're actually working in the clinic, it's busy and you have to get your documentation done. And that's also something we're going to work on in the next slide. Okay. The reason I wrote out more meaty is so you can see the importance of each aspect of subjective, objective assessment and plan. Okay. Any questions with that before we move on to the case study? Okay, awesome. All right, so let's practice, everybody. So this is a time, if you have like paper, pen, or you have a tablet or whatever is next to you, this is where we're going to actually write our note. Okay, so this is the whole scenario, okay, that we're going to practice on. Okay, so this is the history of our patient. Okay, you guys are either the OTR or the CODA on the call here. Mr. Jones Hoffman, age 71, his gender, male, admitted with a diagnosis of left hemisphere CVA, resulting in right side hemiparesis. The patient has a history of HTN, that's an abbreviation for hypertension. That is something you will often see a lot, that hypertension is abbreviated as HTN, falls, and epilepsy. Okay? Epilepsy, just for those that might not be familiar, that just means that they tend to have a lot of seizures. Okay? So the precautions, usually in the documentation or the evaluation, will always give you a history, um, and precautions. The precautions for this particular individual is falls, seizure, Foley catheter, and aspiration. So those are the things that we need to be mindful of. Their prior level of functioning, again, this is something that would be abbreviated to PLOF. His patient lives with his nephew and was independent with ADLs. Patient performed functional mobility independently without AD, which means assistive device, prior to CVA, which is cerebral vascular accident, which is AKA stroke. Okay, so what we will do is we're going to create a treatment session note based on the information. Your session is going to be 60 minutes, okay? Let's just go over the current and short term before I tell you the actual scenario, okay? So currently, this is what the evaluation has said, and they're presented with. So hygiene and grooming, mod assist. Upper body dressing is mod assist. Lower body dressing is max assist. Toilet transfer is mod. Functional mobility is mod. Mod. Bed mobility is mod. Sorry about that. Static sitting balance is a fair plus. Dynamic is fair. Static standing is fair. And dynamic standing balance is a fair minus. Okay. Now these are the goals. These are the short-term goals. I didn't put anything down for long-term because really our focus is short-term since we're now starting to work with our patient. Okay, so short-term goal is patient will complete all aspects of hygiene and grooming, brushing teeth, washing face, combing hair tasks, seated in W/C means wheelchair, requiring min assist and 25% verbal/tactile cues to establish compensatory techniques to perform basic ADLs with increased independence and safety. Okay, this is kind of typical that you would see OTR word, right? The next short-term goal could be something like this. Patient will perform lower body dressing, that's LBD, seated at EOB, which is edge of bed, with mod assist and setup requiring minimal verbal cues to improve functional independence. And then the last short-term goal for this patient says patient will perform functional transfers. Example, bed to wheelchair, wheelchair to toilet. Look at the key there and that says functional transfers, means that it's open for different kinds of transfers. Okay. With moderate assistance and minimal verbal / tactile cues to improve safety, motor planning, and independence with ADL related mobility. All right. So one thing to consider, we have our CPT codes there. If you see it at the bottom of the screen, this is pretty universal. I did only put three. Okay, so we'll base it off of just these three, but there is a lot more. And this is what we use when we are documenting. A lot of times this is used in skilled nursing facilities. Um, if you're working in, let's say, a school system or a pediatric clinic, this might look a little bit different, but usually there's therapy codes, okay? Your therapy code might look a little different depending on what facility you're in, but a lot of therapists, clinicians are working with the older adult population, skilled nursing facilities, so this is why I based it off of that, okay? So you have TheraX, which is therapeutic exercise, self-care, which is very straightforward. You have the numbers there, and therapeutic activity, you have the numbers there. These are the actual numbers that's being currently used in facilities. All right. So this is just the scenario. The patient is in a skilled nursing facility. You arrive at the room in the morning for their OT session. The patient is dressed and in bed. Okay. So I'm gonna go quiet and I want you guys to just, if you have any questions, it's time to ask. But what I want you to do is I want you to think of what therapy session are you going to run based off of this information? Because this is what it's gonna be like when you're in the field, right? All you have is this. Okay, you don't have anybody to tell you what to do today. So you actually have to come up with what you're going to work on. So I want you to take time and I want you to think of your intervention, what you would do, and you're going to base it off of the code because when you're billing, you do have to put your time in, okay? And you have to pick what code you're going to bill under. All right. So I'm gonna go ahead. I'm gonna shut my mouth to give you time to think. And I want you to actually take time to write it down and then we'll talk about it. Okay? And in the meantime, if you have any question, you can go ahead and ask. Once you're done, please just come off of mute. I'm gonna go quiet for like 10 minutes to give you time, and then we'll talk about it. As you're writing, does anybody have any questions or need help with anything? Again, feel free. Okay, did anybody finish writing their note? Or is folks still working on it? Let's do another 2 minutes. Is that enough time, guys? If we do another 2 minutes, I just want to make sure you have time to share your note and for us to talk about it. Is 2 minutes okay? Okay. So I hope I gave you guys enough time to write. I hope you are writing and participating because that's the only way you can improve and get better and also get feedback on your writing. Does anybody want to be brave and share what they wrote? Please come off a mute and share with us. No one? No one wants to share their note? I hope you guys wrote. Okay. Okay, so the reason, okay, I see there's a message in the chat. So the reason why we're writing is because this is the case. This is the case. The case is, we have an individual that had a stroke, and in order to get good at writing is to practice writing, right? So this is a workshop. So this is the presented information. A lot of times when you have a case, all you're going to have is the history, the precaution, whatever their prior level is, maybe some morbidities, and their current level, and then what the goals are. And now you have to say, okay, this is what I have. I'm going to meet this person for the first time, and I need to do a session with them. If you're doing a session with them, you need to be able to document what you are doing. Hence the importance of this workshop, right? Is to write out what you're doing. Okay. So I guess I have no brave soul today. So I guess I will give you an example. I didn't write anything, but I will kind of look at this and I will kind of try to verbalize and how this might go. Okay. And I'll just keep it very simple just for the sake of time here. So it can go, you know what? Better yet, I'm going to give you guys another 2 minutes. I'm going to write it down so you can have an idea of how something like this may look like. Let's do it like that. So if you still want to try to write in the meantime, I'll give you, let's say another 2 minutes. Okay, so I'm back. So I took time to give you guys an example. So at least for the folks that are going to watch the replay, or if you decide that you want more time on this to really do this, you have an example from me. Because this is recorded, and I will put it in the Facebook group, and I also will probably post this on my YouTube channel for those that registered and just wasn't able to make this session. Okay, so with the sake of time, we have about 5 more minutes of this workshop. I will break it down how something like this would look like. So, for example, my subjective, if I walk into this patient's room and this is my case study, it would probably go something like this. So this would be my subjective. Patient reported 5 out of 10, 5/10, right hand pain, nursing made aware and pain medication administered prior to start of treatment session. Okay, very straightforward, very concise. And I'm also providing detail of what is happening and what I did about it. Okay. Next part, I'm going to pick self-care as my CPT code that I'm going to document this small portion of my writing into. Okay, because one of the goals here, as you can see in the short term, that I'm going to address is upper body dressing. Okay. Patient assisted out of bed requiring min mod. So that's min/mod assistance to transfer from supine to sit at edge of bed with moderate verbal cues for left upper extremity hand placement and safety. Patient performed upper body dressing utilizing one hand technique strategy requiring mod assist with 50% tactile cues for sequencing and task completion to increase upper body dressing performance. Of course, you can add so much more to that, but just for the sake of time, I just want to write that down real quick so you guys have an idea of how that might look like. I would probably even include maybe their sitting balance. Okay, maybe I would document how was the sitting balance. So there's a lot more meat that you can add to your note, but that just gives you an idea of what I would actually put in that self-care CPT under self-care CPT code. Okay, any questions? Okay, you guys are just a quiet bunch. Are you guys still with me? I hope you are. All right. So I hope that you like this workshop. If you are not very familiar with me, I'm assuming that everybody is. Please go ahead and visit my website, tamisha.tutoring.com, where you can get information, email information of different topics, and I'm always giving tips and suggestions. I would like to do these workshops once a month. If you guys want it, I will do it. If not, then I won't do it. But if you do let me know that I like workshops and you have a workshop idea or suggestion, please do. You could email it to me. You could go to my website and use a contact form and say, hey, I attended the workshop, or hey, I watched the replay. It was very helpful. Can we do a workshop on this topic? I would love to do it. Not a problem. And if you're not on my if you're not subscribed to my social media, please do so. Definitely visit me on YouTube at Tamisha Tutoring, where you can get more videos with me just explaining things just like this. Okay. Before I let everyone go, is there any questions? I hope that this workshop was helpful. Any questions?
Yeah, it was really helpful and thank you so much. And could you please do a session on how to set goals like long-term goals and short-term goals? That will be really helpful for me.
Okay, I'm gonna write that down. So
Okay.
setting goals, long term and short term. Okay. And again, please, this is going to be recorded, so I will put it in the Facebook group. I will put it on my YouTube channel for you to see it. And I will also send it out. If you're part of my newsletter community, you'll also get a link to this to watch. I would definitely go back to this video, look at the case study, and practice writing those notes. And then feel free to email it to me for me to kind of review it or, comment on it if you would like. Okay? All right, guys, that is about it. Thank you so much for attending this webinar, and I will see you guys in a new one or a next one. Okay?